Welcome to the next topic of the preceptorship course. Now we will discuss the role of a preceptor as a facilitator. Course outline. At the end of the course, the participants will be able to understand the difference between teaching and facilitating. Know the types of the facilitator. Determine the facilitator's role and its concept of authority. Understand the connection of critical thinking, decision-making, and problem-solving. Recognize the importance of time management in organizing, prioritizing, and delegating tasks. Understand the importance of managing conflicts, and know the different conflict styles. What is a facilitator? Facilitator is a guide or discussion leader for the group, an individual who enables groups and organizations to work more effectively in a neutral way by not taking sides, and advocate for fair, open, and inclusive procedures to accomplish the group's work. The definition of a facilitator in the following. In quality, facilitator is the one who contributes in the structure and process to interaction so groups are able to function effectively in order to make high-quality outcomes. In business, the facilitator works with business styles to make easier for the group to arrive at its own decisions. In a discussion or meeting, a facilitator leads and manages by keeping the members on track. Facilitating a conversation among students about the text rather than instructing the students directly is practice in the education field. The facilitator is both a problem solver and critical thinker to help a group to improve the way it identifies and solves problems by supporting everyone to do their best thinking. What is the difference between teaching and facilitating? In teaching, the teacher leads the group and provides all information to the group, and instructing the learner on what to do to help acquire the knowledge, skills, and proper approach and right attitude. In facilitating, the facilitator guides the process, help and make it easy for members to learn together in a group, or to achieve something together as a group. This develops teamwork, make the group more creative, innovative, and to be able to brainstorm to come up with a quality result. Types of facilitator. Internal facilitator carries the dual role of guiding, while also being a member of the group. Part of the middle or upper level staff members with skills in guiding group discussions, processes and decision making. The advantage is they have knowledge of the history and context of the situation. They have knowledge of, or relationships with many of the institution's personnel. They may cost less than hiring an external facilitator. The disadvantages. Group members may perceive an internal facilitator as against certain staff or bias about the issue. May not want to risk their position within a group by asking controversial questions. They may be reluctant to challenge people in positional power for fear of retribution. External facilitator. Someone who is not a member of the group or institution. Primary interest is to guide a process that assists the group in discussing and taking action on issues. Advantages typically create an atmosphere of neutral facilitation. They bring fresh perspectives and new questions to the discussion. They are willing to ask difficult questions and confront assumptions. They can move the group forward when dealing with difficult or controversial issues. Disadvantages. It requires time for the facilitator to become familiar with the issue, context, participants and managers involved. May be viewed as outsiders and not respected or trusted. They typically require a fee for their services. They may only be present for a portion of a larger process or series of questions. Concept of authority. Three concepts of authority. Alternates initially in the educational context as being tutelary authority or facilitative trainer based on the competencies including the knowledge, skills, and attitude of a preceptor as a tutor. Political authority or facilitative leader involving the exercise of educational decision-making. This is with respect to the objectives, program, methods, resources and assessment. Charismatic authority or facilitative consultant influenced by presence, style, and manner. To be an effective facilitator, there are different roles that you have to apply. The facilitator roles that every preceptor must apply in the nursing units. The preceptor should orient the new trainee or interns to the unit set up to be familiarized with the physical environment. Promote sense of belongingness by allowing time for the new trainee to socialize in the unit and to be familiar with the unit rules regarding meal breaks, request of leaves, and others. The preceptor should arrange clinical experience by choosing assignment based on the competency of the staff, and to negotiate with the other staffs regarding the limitations of the new orientee. For them to understand the strengths and weaknesses of the new staffs to avoid expectations and confusion of unit roles to be monitored or to be with minimal supervision only. As a facilitator, the preceptor should have a process of planning and conscious control over the amount of time to be spent on specific activities to increase effectiveness, efficiency, and productivity. Facilitator should know how to organize, prioritize, delegate tasks to members by managing time effectively following the priority matrix. The preceptor must know which task should be done first, which task to be done next, and can be delegated to the new staff, what can be done later or divide among the group, and which task should not be done based on the level of importance and urgency of the task. In order to effectively delegate tasks, the preceptor should select the right people based on the evaluation of their competencies and unit performance. Once selected, the preceptor should train and develop the individual, explain the task, and give the necessary information, and check understanding. Know when to stand back and support the staff. Control in sensible manner and sensitive way, in order for the staff to feel that you trust them and to empower them. Managing time in order to finish all nursing tasks can develop reflective thinkers, encouraged to apply model or systematic approach to thinking and problem solving. This also fosters critical thinking. Try to do the connect the dots activity, in order for you to exercise your critical thinking skills. Draw the specified number of lines stated below the picture by connecting all the dots without lifting your pen. Let's see how many will you get and complete. Enjoy discovering your level critical thinking through this activity. Check how many correct answers you've got. Well done. Let's see in the next activity how good you are. Try the brain teaser exercise to test again your critical thinking skills. With the specified pictures and words, form a word or phrase that best describe them. Think deep and outside the box. Sometimes it's not how it really looks. Take your time and enjoy the activity. Let's see how many correct words or phrase you are going to complete. Let's try to solve the first one. It shows a picture of a box with a word of sound below. The answer is sandbox. Now try the others. As a preceptor, you should know the connection of critical thinking in solving a problem and making decision. Critical thinking is a process with the goal of which is to make reasonable decisions about what to believe in and what to do. Problem solving is a cognitive process directed at achieving a goal, when no solution method is obvious to the problem solver. Decision-making is a systematic sequential process of choosing among alternatives, selecting the best, and putting the choice into action.
It is just a cycle. When a problem occurs, a person needs to do the process of critical thinking, in order to choose among alternatives, selecting the best and implement the decision made to solve the problem. Application of the critical thinking steps in the clinical setting. The critical thinking steps are the following: interpretation, analysis, inference, explanation, evaluation, and self-regulation. In interpreting the clinical data, staff should distinguish what information are facts, what are only assumptions, and inference. Facts are informations used as evidence or as part of a report, for example laboratory result, X-ray imaging, etc. Assumptions, a thing that is accepted as true or as certain to happen, without proof. Inference, a conclusion reached on the basis of evidence and reasoning. In analyzing data, staff should know how to prioritize and make connections among the collated data. Recognize the existence of problems. Distinguish between relevant and irrelevant information. Begin to analyze nursing problems and define the possible courses of actions. For example, if the patient has kidney disease, what laboratory works will be monitored, such as renal function test, BUN, and creatinine level. If this lab works are not within the normal range, what should you do first for this patient? Inference. Drawing conclusions based on evidence or data. Comprehending the meaning of subjective and objective data. In applying this in the clinical setting, the staff should weigh risks and benefits of various courses of actions, identify gaps in information before making sound decisions. For example, based on the signs and symptoms that appear to patient, what conclusions can you draw? Explanation. In every nursing intervention done to the patients, nurses must be familiar regarding the rationale. Always explain and provide rationales for conclusion, and give reasons to patients so they will cooperate and understand their treatment plan. In evaluation, nurses should continuously assess the data for relevancy to the situation, and ensuring that the data supports the conclusion. Self-regulation refers to behavioral control processes, including the ability to inhibit and delay responses, flexibly shift and adapt, and maintain emotional control in order to achieve desired outcome. This includes the ability to manage situation, continuously questioning, examining and monitoring one's thinking or decision for accuracy. For example, asking questions or referring patient for verification, comparing and contrasting situations. Continuously seek for further data to support and validate conclusions. Another role of a preceptor as a facilitator is to manage conflicts. The aim of conflict management is to enhance learning and group outcomes, including effectiveness of performance in organizational setting. Conflict occurs when what you have and what you want are different, a difference in pattern of energy, just nature's primary motivation for change. In conflict management, a facilitator serves as mediators that help parties to reach a settlement by assisting with communications. Moderators that guides the two sides through conflict and disagreement towards a mutually beneficial agreement. Arbitrator that hears evidence and make decision to solve the conflict. Staff should understand the causes of conflict. Conflict can happen when members have different views or beliefs that clash. Sometimes conflict can occur when people misunderstand each other and jump to the wrong conclusion. Issues of conflict that are not resolved peacefully can lead to arguments and resentment. The following differences are: personality differences, difference in values, difference in perspective, difference in goals, cultural differences. In reality, conflict is an inevitable and normal part of the cycle of enduring relationships. Conflict is not always negative, and contest to be won on who's right or wrong. Conflict is not always a sign of poor management. Conflict is not always that if left alone, it will take care of itself. However, not all the time, a conflict must be resolved at once. Understand your conflict styles through the behavior of the following animals. Watch the video later to appreciate more the relationship of their behavior to the type of conflict styles. Whenever you're in a conflict with someone, there is always one factor that can make the difference between damaging relationship and deepening it, and that is attitude. How are you going to handle the following common conflicts in the nursing units? Conflict between preceptee and preceptor, staff and unit manager. Five steps of conflict management. Establish a positive environment. Always select the proper time and location that is mutually acceptable and convenient on both parties when to discuss the conflict. Understand the other person's point of view by asking open-ended questions and listening attentively to the answers. Also check your understanding by repeating back the essence of what you have heard. Clarify and define the issue. Explore the other person's thinking and what is important to them, including concerns, fears, hopes and expectations. Generate alternatives. Practice brainstorming and generating options together. Insist on examining a few alternatives when more than one option is suggested. Problem solve. Evaluate the options. How will they meet the interest of both parties? Form an action plan. Understand who, what, where, when and how. The new leader is a facilitator, not an order giver. Thank you for watching.